How do I control pain of avascular necrosis of hip? First of all, I would like to give you a short brief of avascular necrosis. Avascular necrosis is a condition where a hip joint, that is the ball of the hip joint, has got reduced blood supply or complete lack of blood supply due to conditions such as steroid intake, alcohol intake, and there are some patients who develop avascular necrosis without any reason. The pain of avascular necrosis can be of two types. One is initial pain, which is due to the ischemia, that is loss of blood supply of the bone, which is a deep throbbing pain. The next pain is in stage 2, 3 and 4, which is arthritis pain. Now in both the cases, the pain can be controlled with the help of regular non-steroidal anti-inflammatory drugs or opioid analgesics. But the pain cannot be controlled completely, as it is a deep pain which is coming from the bone or from the joint. The real treatment of avascular necrosis is either stem cell therapy, forage or hip replacement. So pain can be controlled in initial stages for some duration, but surgery will be necessary with or without stem cell therapy.